Hello guys, welcome to Dr. Science. So today we are going to understand why aspirin is contraindicated in renal failure. In order to understand this, we have to understand what is the normal physiology of the glomerulus. So imagine these are your prostaglandins, such as your prostaglandin E2 and prostaglandin I2. Now these prostaglandins are causing afferent arteriolar dilation. Whenever there is afferent arteriolar dilation, there is increased in renal plasma flow. And whenever there is increased renal plasma flow, there will be increase in the hydrostatic pressure. And this increase in hydrostatic pressure will eventually increase in the GFR or the glomerular filtration rate. So once again, due to afferent arteriolar dilation, there was increase in the renal plasma flow, which was causing increase in the hydrostatic pressure, which was eventually causing increase in the glomerular filtration rate. It means the kidneys are hydrated well, or there is enough perfusion of the kidneys. Now imagine you gave aspirin to this patient. Normally aspirin is a substance. Aspirin is a non-steroidal anti-inflammatory drug. So imagine this is the phospholipids, and phospholipids in the presence of an enzyme called as your phospholipase A2 gets converted into a compound called as your arachidonic acid, and this arachidonic acid will eventually synthesize your prostaglandins and your leukotrienes, and aspirin will eventually inhibit the prostaglandin synthesis. If there are no prostaglandins, what will happen? We will try to understand. There is no synthesis of prostaglandins. When there are no prostaglandins, there is afferent arteriolar constriction. If there is afferent arteriolar constriction, there is decrease in the renal plasma flow. Not only that, there will be decrease in the hydrostatic pressure, and eventually there is decrease in the GFR. So if there are no prostaglandins, there is afferent arteriolar constriction, and this afferent arteriolar constriction, due to this afferent arteriolar constriction, there was decreased in renal plasma flow, hence there is decrease in hydrostatic pressure, hence there is decreased in the GFR or the glomerular filtration rate. So we can say that the kidneys are not perfused well. The kidneys are not hydrated well. Now imagine a patient who is already having a renal failure. If the patient is already having a renal failure and the perfusion is very less to the kidneys, on the top of that we gave aspirin. Now eventually there will be damage to the kidneys, or there will be chronic renal failure or chronic kidney injury. Okay, so that is the reason we don't give aspirin to the renal failure patient. Thank you guys.